Hey, welcome back. We are here with Dr. Sheila Garvey, a general surgeon at Ogden Clinic, to talk today about breast health and breast cancer. Okay, so first of all, there's a lot of conflicting and incorrect information out there about women and breast cancer.
Correct.
Okay, so often we have the impression that if there's no history of breast cancer in the family, then we are just golden, we're good to go, but that's not true, right?
That is so untrue. Most women with breast cancer did not have a family history prior to their diagnosis.
Well, it's got to start somewhere. Right?
It does.
You know what I mean? So it's got to, so maybe it wasn't your parents, but you're the first. And so what are things we should be doing every day?
Well, and it's not every day, it's at least monthly, and women should be doing self-breast exam, and just be aware of your body.
Okay, now we also, it seems like, we hear this in the media, it seems like we're hearing about more younger women that are getting diagnosed with breast cancer. Is that true?
So the frequency of breast cancer is increasing. I think that people are more aware of younger diagnosis, but I don't know that the actual frequency of young people is increasing. We're also getting much better at diagnosing breast cancer. The technology as far as MRI and ultrasound and mammography has come a long way, and we're getting much better at detecting it earlier.
Now, I've also heard that women over 40 in the state of Utah are on the bottom of the list for people getting mammograms. Is that true?
It is true.
Why is that?
I think women in Utah don't take time for themselves. You're always the last person, and getting your mammogram appointment isn't nearly as important as getting your kid to the dentist.
All right, so we also have heard a lot about the BRCA. Is it called the BRCA?
BRCA.
BRCA, okay, and that was, Angelina Jolie really brought that to the surface,
She did.
right? Okay, so what do we need to know about that and that test, and do we need to get that test done?
So BRCA testing is a genetic test that looks for people with genetic breast cancer, which is actually a very low frequency. The only people who should be tested for BRCA are people with first-degree relatives and a strong family history of breast cancer or breast cancer themselves. So women under 50 actually don't qualify unless they have at least 2 first-degree relatives, which is your mom, your sisters, and your children. And nobody else should be tested. It's not a screening test, which is one of the big misconceptions out there, is that everybody should just go get the test. It's not a test for you if you don't have a family member with breast cancer.
Now, is a test covered by insurance, or, is it expensive?
It's way expensive. It's about $3,500.
So very pricey.
Very.
Okay, so women with large breasts versus small breasts, is there a difference in frequency of breast cancer diagnosis?
The frequency of breast cancer is the same for both women with large breasts and small breasts. The difference being that small breasts are probably easier to detect cancers at an earlier stage. Mm-hmm. You can hide a lot in a large breast. So I think it's harder for large-breasted women to, number one, examine themselves, and number two, to be diagnosed earlier.
All right, and then what about screenings? What do we need to know about screenings?
So screening mammography right now, the recommendations are baseline mammogram at age 35. If you have somebody in your family who was diagnosed at breast cancer, breast cancer at a very early age, like under 30, things are different, so those don't apply to you. But for normal population, breast cancer should be screened at age 35 with a baseline mammography, and that's kind of changing. And then annually after age 40.
Okay.
According to the American College of Surgeons.
Thank you so much for the information. And Ogden Clinic is where we can find you. And I'm sure there are a lot of websites where you can get information on breast cancer awareness too, right?
The American Cancer Society actually has an excellent website and excellent information on self-breast exam.
Thank you so much. Love your
Thank
pink.
you.
Looks great. Stay with us. We'll be right back.